Hello, everyone. Thank you for joining Practitioner Magazine. And today we are talking with Ralph Stevens with ralphstevens.com. Hi, Ralph. And Ralph has been an acting therapist or a licensed therapist for over 20-plus years. He's a teacher, an educator of medical and sports massage. He has a textbook out. And Ralph's here today to talk to us about a new therapy, a manual therapy referred to as NRT, which is neural reset therapy. So please take it away, Ralph.
Well, thank you, Brian, and I'd like to thank everybody that's watching this and welcome you to the first issue of Practitioner Magazine. It's a great honor to be in the first issue, and I have some really exciting information to share with you. I've been around the profession for about 28 years now, and I've been teaching for over 20 of that. And back in the 80s, I caught a wave that swept through the profession called neuromuscular therapy. Paul St. John, and I ultimately was on Paul St. John's teaching staff. And ever since then, everything else has just been a variation on the theme. All of a sudden, I found a brand new therapy, something completely different. Might look like some things that you've seen before and that I've seen before, but ultimately it's a brand new system of addressing soft tissue pain and dysfunction and normalizing soft tissue. And I'm extremely excited about it. I'm so excited about it, I can't wait to get out and share this with people. This comes from a good colleague of mine and a friend that I've known for probably 20-some years. Well, no, probably 15 years. His name's Lawrence Woods. He's out of Indianapolis, Indiana. He's a clinician there. He has a degree in public health education. He has a dental hygiene degree and a dermatology tech degree. So he does have a medical background. He's been a therapist for over 25 years now. And he's was trained with Sandy Fritz as one of her schools initially. And in that training, Sandy showed a way to use reciprocal inhibition, which is a automatic mechanism in our nervous system that turns off the antagonist muscle to any movement that we make. So if you contract your bicep, your body automatically inhibits the tricep so that it can relax and elongate. And it's why can't we use that in therapy? And maybe we are using that in therapy, but nobody figured out how to do it consistently, predictably, and anywhere for any muscle in the body. That's what Lawrence Wood figured out over the last about 5 years of very intense study, studying with everybody who had tried to use this mechanism, and many had, but not real consistently, not real effectively, until Lawrence has finally got the insights to put together this system. It's called neural reset therapy. There's an upper body class and a lower body class and an advanced class coming probably next year sometime, and that will be the entire training course for neural reset therapy. So what's this all about? This is the fastest, quickest, easiest way that I have ever found to change the tension, the tone, the tonus as you might call it, or even we could call it the spasm in a muscle, and get it to relax, to reset, and to resume a normal or shall we say, a default setting, back to what should be normal for that individual. And we can elicit that in a matter of seconds. Usually our longest application of any one of the 6 application techniques is 20 to 30 seconds max. Usually it's 5 seconds, maybe less than, sometimes 2 or 3 seconds, sometimes 10 seconds. It depends on the person's nervous system and how they respond. But in 30 seconds, I can reset a psoas muscle. And I don't have to dig down into someone's abdomen to do it. All I have to do is hold their psoas muscle in a position and stimulate it correctly, and the muscle relaxes. It's absolutely incredible. I don't have to use my thumbs. I don't have to strain. I don't have, the patient does a lot of the work, and yet it's not stressful and hardly ever painful to the patient. The only time it is painful is if, for example, lifting their leg up causes their back to hurt, and then we don't have them do that. We find another way to do it. There are 6 different application techniques, so we've got multiple ways to address something. So it's really an exciting therapy that has allowed me This is going to extend my therapy career by many years. I've already got 27 thanks to good body mechanics. But lots of therapists that are studying this work can see that this is going to make them last a lot longer standing by the table. It's going to make life much easier on the patients, clients, whatever you want to call them, and it gets incredible results. You can go to the NRT website, to the neuralreset.net website, and Lawrence has posted 4 videos there. A couple of them he's working with yoga instructors, people in yoga instructor training, who've been practicing yoga for 5 years or more, who are relatively flexible people but have certain things they just couldn't do, and in a matter of minutes he has them doing yoga postures or going further into yoga postures than they've ever gone before, without doing any stretching, without pulling, straining, and without any danger to the patient. So it's really, really exciting work. Brian, I think you experienced a little bit of it when we were together in St. Louis, right? I thought Brian was on a two-way call here, but I guess he isn't. Well, anyway, this work is based in the laws of Dr. Sherrington's second law, which is Sherrington's law of reciprocal inhibition. Sherrington's law of reciprocal inhibition says that when one muscle is contracted, its antagonist is inhibited. And when its antagonist is inhibited, that muscle relaxes. Reciprocal inhibition means to inhibit the contraction of the reciprocal, the opposite muscle. We do that every time we move. But what if we could elicit that response from the nervous system in a manner that it lasted, that it actually caused the nervous system to go, what the, and reset the muscle? We can do that because we challenge the nervous system with a non-threatening stimuli, stimulating mechanoreceptors, never stimulating the nociceptors, the pain receptors in the body, so the patient never experiences pain. They don't even experience the hurt so good pain that we typically have to inflict to do trigger point therapy or to do neuromuscular therapy or orthopedic massage or even myofascial release to some degree. There's nothing like that that the patient experiences, so it's a very pleasant experience for them, other than we aren't doing effleurage. And so sometimes people finish an NRT treatment by doing some effleurage or doing some general massage or some craniosacral therapy or some lymphatic drainage or whatever other therapies you've been trained in. In NRT, we're not saying that you, as the therapist, can only do this if you do this. You know, there are those kind of people out there whose egos say that, well, if you're going to do this kind of work, you can only do this kind of work. But that's not true with NRT, and quite honestly, it's not true with any work, in my opinion. It's all a continuum, and NRT is a part of the continuum that allows you to quickly reset the tonus of muscles, and then you can do lymphatic drainage if you know how to do that. You can do craniosacral therapy. The whole body is more relaxed. You can do anything else you need to do. The one limitation right now of neural reset therapy is that we're resetting muscle fibers. Therefore, when we get down to the tendinous periosteal junctions, ligaments, things like that, we're not resetting those. However, when we take the strain off of that tendinous periosteal junction, when we take the strain off of the ligaments, then the blood flow returns to them and they heal much faster, and often the pain that's left in those goes away in a few hours or the next day. How long does NRT last? Well, it lasts as long as anything else that we do, and quite honestly, it seems to last longer. I've worked on quite a few people. I've mostly been working on therapists as I promote this work and show it around the country. And the therapists present me with their most difficult problems. Quite often, that problem goes away and stays away for several days to a week or two, which is much longer than it had stayed away from other forms of therapy. I did work on one lady that had a problem in her pelvis around the coccyx area. We do have a release that releases some of the muscles in the coccygeal area, although we don't work directly on the coccyx. But Her pain was gone for several hours, but it did come back the next day. She's had this for years. So how many other therapies would get a pain condition that someone has had for years to go away completely and not come back at all? We tend to fall back into our own patterns. But for the most part, people find great relief from this work, and it does last as long or often longer than any other therapy that I've found. And you can do this work in two ways. You can learn the resets, and just whenever you find a tight muscle as you're doing a typical orthopedic sports massage, medical massage, switch and do an NRT reset, and poof, the muscle relaxes in moments. Or you can do a full routine as developed by Lawrence Woods and as we teach in these seminars, so that you actually release the whole body. You can do that in 20 to 30 minutes, and then you've got the other time left in your session, whatever increments you work in, to do other things, or to do the upper body, or to do some Swedish massage so the patient feels like they've had lubricant put on them and rubbed it around. Although we typically do NRT through the clothing. You don't have to have the patient disrobe. We just palpate the muscle, do a reset, palpate the muscle again. If the muscle is significantly better but not all the way better, we'll do the reset over. If the muscle didn't change, or maybe there's just a little bit left, we might tweak our reset and do it from a different angle, do a different type of reset, do one of our different reset applications, or maybe we'll decide, gee, maybe to get the hamstring to completely release, I need to let the gastrocnemius go, I need to release the gluteus maximus, because everything is interconnected fascially. So sometimes you need to work on either side of the fascial plane, boom, the muscle melts. So we really have incredible fast results with this, and you can continue on with your massage, or you can do the whole NRT routine. I find that the work lasts much longer and is much deeper in its relaxation and in the results that you get when you do at least half of the body, the lower body or the upper body. In NRT, we divide the body into two segments. We break it here at the bottom of the rib cage. And so diaphragm and up is the upper body, and psoas, abdominals, quadratus lumborum, the lower latissimus dorsi on down, that's all what we call the lower body. So if I do the entire lower body, that takes care of low back, hip, knees, ankles, legs, thighs. It's really very quick and very efficient therapy. I think you'll really find this therapy to be amazing. As I say, there's videos posted on neuralreset.com. There's lots of testimonials of people that have taken these courses. And the majority of the people that have taken the Neural Reset courses are well-established, experienced therapists, some with 15, 20, 30 years in practice. They take this work and say, wow, this is going to give me years more in my practice. This is going to improve anybody's practice. And when those kind of people latch on to something new, because they've pretty much seen everything that's out there, when they recognize this as something new that's a significant addition to their practice, that really encourages me that I have found something really new. Not that I can't judge that on my own, but it's always great to have consensus and reinforcement, you know. And
Absolutely.
So we've been spreading this around the country, showing it at some conventions where I've been doing demonstrations, and I've shown it to school owners, and people want to sponsor this work. So it's going to be coming to areas near you. We hope real soon. The schedule is posted on the NRT website. It's also posted on my website, ralphstephens.com. I spell my name with a PH. That's S-T-E-P-H-E-N-S. And so I really look forward to sharing this work with you, with the readership of Practitioner magazine. Maybe we'll do some more information on it, or some actual demos that we can put up on the magazine in future issues. And I really thank you, Brian, for inviting me for this first issue. We've written an article, Brian and I put together an article that you can read that will be part of the copy part of the magazine. Goes into more depth in NRT and gives you some links to check out. So I urge you to read that article. Brian, do you have any other questions or anything you wanted me to cover while we were doing this?
Yeah, I apologize. I had muted myself just to make sure I didn't have any background noise earlier. And yes, it was amazing. It was amazing in St. Louis at the Alliance for Massage Therapy Education Conference. Being all educators, as Ralph was sharing that and treating them, to see, you know, the amazement they were seeing from this technology and type of treatment. And it really does expand, even though being from massage over the years, obviously, that that's been one of the main areas of opening it up, but it really spans across, as you had mentioned, chiropractic, acupuncture. I mean, it obviously, from everything you said, physical therapy, I think anyone can see where this application and the benefit and the added benefits that it brings can be utilized across many areas, correct?
Yes, we're really excited about the fact that this work, neural reset therapy, has great potential for chiropractors that want to do a little bit of soft tissue very quickly. They can just jump in and do a reset on the piriformis, for example, or on the suboccipital muscles to facilitate their adjustments, and it doesn't take 20, 30 minutes, half an hour of massaging. It doesn't hurt their hands, because chiropractors' hands take enough beating doing their manipulations. And so it has potential in the physical therapy world, in the athletic training world, yoga therapists, and other people who's ever got a license to touch the body. This is going to, I think, really be a cross-platform technology that's going to help a lot of people, a lot of practitioners help a lot of people get out of pain.
And that's something you just said there is, it's not only fantastic for the patients or clients, but what it can add in longevity to the practitioner's career.
Absolutely.
And that it doesn't require, could you expand a little bit upon, how that benefits even the practitioners or therapists that are applying the technique?
Well, anybody that's out there that's been working for a while knows that thumbs start to get very, very tired after doing a lot of trigger point therapy, or even your fingers if you're using your fingers in that work, wrists, even in the finest of body mechanics. It does take its toll over time. And with this technology, yes, we use our fingers to palpate the muscles, but we're not working as hard. We're not holding points or things like that for any long period of time. So it really makes it much, much easier for the therapist. And we've trained some therapists that have disabilities and handicaps, injuries that were preventing them from doing their practice, or they were reduced to a very limited practice. And now they're back seeing more people and not suffering as a result of doing the work. So, gee whiz, if this can give a few good therapists a few longer years in the profession, it gives them that many more years of satisfaction and that many more people helped.
Absolutely. And so you, as you mentioned, you have your new seminar series and training or education classes. They are broken up, as I understand, into an upper and a lower. Is that, could you explain a little bit how the classes?
That is correct. We have two. Actually, there's 4 days worth of training for the upper body and 4 days worth of training for the lower body. But we realized that 4-day seminars are very expensive to put on and very expensive to attend. So we have broken the core material down into two 2-day seminars, typically Saturday, Sunday. So there's 2 days for the upper body, 2 days for the lower body. We typically present those 2 to 3 months apart, so therapists can go out and work with the techniques and then come back and have the basic fundamentals reviewed and then go into the other half of the body. Those are 16-hour workshops. They are approved by the National Certification Board for Therapeutic Massage and Body Work. Neural Reset Trainings is an approved organizational provider, and of course I'm an approved individual provider, and most of the schools we teach at are approved also. And then there is a home study DVD program that you can purchase that gives you 2 more days of training, lots more resets, different ways to do muscles, more muscles that aren't taught in class. And if you complete a test, a small open book test, then you can get 16 hours additional continuing education credit approved by the National Certification Board. And when you take those 2 classes and the home study programs for those classes, then you're eligible to take the advanced class, which will be 2 or 3 days of even more incredible work, and then you'll be eligible for the actual neural reset therapy certification. And we're keeping that very defined. We really want a certification in neural reset therapy to mean something, and that the work is going to be done consistently and provided to the public in a consistent manner, so that when the public goes looking for NRT and they find somebody that has done the program, that the public is going to get dependable work done on them. Doctors will have dependable people to refer to, so that we really get good results with this work. So we've got courses yet this year coming up in Pittsburgh, Pennsylvania. We're going to do both the lower and upper body there very soon. Just a couple of weeks in Pittsburgh will be the lower body, and upper bodies in December. Our North Carolina class is sold out. Our Cedar Rapids classes are sold out. But we're scheduling new classes for next year, more classes for next year. And I believe there's an October class in Indianapolis that still has a few people in it, spaces available. So this is becoming very popular very fast. And I urge people to get in on this, because it's really going to change your life as a therapist and help you change people's lives that come to you.
Mm-hmm. That's excellent. So yes, as to see the class schedules where Ralph are going to be teaching, you can visit Ralph Stevens, STEPHENS.com, and see the class schedules, where they're going to be being held this year, and where all they'll be traveling to in 2014. Well, Ralph, thank you so much for your time. I appreciate it. Look forward to everybody's feedback. It'll have his contact information, so you can certainly call, ask questions, or visit the website and get registered for one of their classes upcoming. Thank you again, Ralph. We appreciate it.
Thank you, Brian. Thanks so much. Thanks, everybody, for watching. And read the article. It's got all the links to the websites, mine and Neural Reset. And I hope to see you in a class someday real soon.
All right. Thank you. Hello, everyone.